Welcome to Unit 5. In this unit, the topic of interest or discussion is learning. Specifically, we'll talk about classical conditioning, operant conditioning, and cognitive learning in modules 5.1, 5.2, and 5.3, respectively. In this module 5.1, we'll talk about classical conditioning, and the outcomes for this module would be to define and understand learning at a very general level, then talk about some basics of one form of learning called classical conditioning. Then we'll look at the properties of classical conditioning, followed by the factors affecting classical conditioning. So let's talk about learning in general first. Psychologists define learning as a relatively permanent change in behavior acquired through experience. So note the terms used here. Learning is defined as a relatively permanent change. In other words, this change may not necessarily be permanent. It is more likely to be enduring. Then, learning is also defined as a behavior that is acquired through experience. In other words, learning is not inborn. Learning specifically refers to those behaviors that are acquired, learned. There are three forms of learning that we'll discuss in this chapter. Um, the first form is called the classical conditioning. The second form is the operant conditioning. And the third form of learning is cognitive learning. In this module or video, we'll first talk about the classical conditioning. In the next video, we'll talk about operant conditioning. And the last video, we'll discuss in detail about cognitive learning. Ivan Pavlov was a Russian physiologist who did research on digestion. Pavlov discovered that dogs will salivate in response to the sound of a tone, in a process now called as classical conditioning. Let's see how it works. Pavlov noticed that the dogs in his experiment salivated before being fed whenever they heard the clanging of the metal food carts being wheeled into the laboratory. In order to isolate the cause, Pavlov paired the sound of a bell with the presentation of the meat powder, and he did it several times. Then later on, he presented the sound of the tone alone, without the meat powder. What do you think happened next? Well, you're right, the dog salivated to the sound of the bell. In other words, the dog has learned to salivate to a new stimulus now, in this case, the sound of the bell. This is a classic example of classical conditioning. Well, in other words, Pavlov demonstrated that a learned association was formed between the pairing of two different events in animal's environment. In this case, the environment events were the tone of the sound of the tone or the sound of the bell and the meat powder. At first, the bell tone was a neutral stimulus. In other words, it did not cause the dog to drool. So let me introduce you two new constructs here. One is the UCS, the unconditioned stimulus. The other one is the UCR, the unconditioned response. Unconditioned here refers to unlearned or natural. So an unconditioned stimulus is a stimulus that elicits a specific response in an organism. For instance, food will naturally elicit the salivation response in dogs. Food here is the unconditioned stimulus, and dog salivation would be an unconditional response. But what it basically means is that unconditional responses are those natural inborn reflexes that we are born with. For instance, our sneezing reflex. We sneeze to any irritants like dust. Dust would be an example of an unconditioned stimulus that elicits an unconditioned natural reflex response, which is sneezing in this case. Keep in mind that these unconditioned reflexes or responses are specific to only certain stimuli. In other words, you don't sneeze to to anything other than an irritant. So unconditioned responses are very specific responses to some specific stimuli. So conditioning is pairing a neutral stimulus with an unconditioned stimulus. In other words, in this example, when you present the food along with the sound of the bell to the dog repeatedly several times, over time the dog learns to salivate only to the sound of the bell. Keep in mind that initially the dog would drool or salivate to the food but not the sound of the bell. But eventually, after several repetitions, just the sound of the bell would be sufficient for the dog to drool. This is called conditioning. This repeated pairing of neutral stimulus with the unconditioned stimulus is called conditioning. After conditioning or this pairing, the neutral stimulus becomes an the neutral stimulus becomes a conditioned stimulus, which means that this bell alone now elicits the response of salivation in dog as a result of this learning. Also keep in mind that uh, unconditioned response in this case is the drooling or salivation in the dog. The conditioned response is also the same drooling or salivation. The only difference here is that the response in the second case, which is the conditioned response, is to a different stimulus. In other words, In classical conditioning, or according to classical conditioning, the dog has learned to elicit the same salivation response but to a new stimulus. And this new response, which is basically an old response of salivation to a new stimulus, is the conditioned response. Here we see a schematic representation of classical conditioning, and we can divide classical conditioning into three different steps. The first one is before conditioning. The second one is during conditioning. The third one is after conditioning. Before conditioning is when the dog salivates only to the food. The sound of the bell is a neutral stimulus. Conditioning is when you pair the neutral stimulus with the unconditioned stimulus repeatedly. So the dog learns to associate these two. After conditioning, the tone or the sound of the bell alone would elicit the salivation response, but the salivation response to the sound of the bell is now called the conditioned response. This brings us to the third objective or outcome for this unit, that is the properties of classical conditioning. There are three properties of classical conditioning that we'll discuss. The first one is extinction, second one is spontaneous recovery, third one is stimulus generalization, and the fourth one is stimulus discrimination. Let's talk about extinction first. Extinction is when the bell doesn't elicit the response of drooling in the dog. It is the process by which the association between the unconditioned stimulus, which is food in this case, and the conditioned stimulus, which is the sound of the bell, is broken. This happens when the bell is presented enough times without presenting or without being paired with the meat, and over time the response extinguishes. As you can see, when the food and the bell is presented together, the strength of drooling or strength of the conditioned response is high. But over time, the salivation response of the dog to the sound of the bell reduces to an extent that over time it's completely lost. And this loss of conditioned response to the conditioned stimulus is called extinction. This brings us to the second property of classical conditioning, that is spontaneous recovery. Spontaneous recovery is a phenomenon discovered by Pavlov. And in this, the conditioned stimulus suddenly elicits an extinguished conditioned response. In this example, the dog suddenly salivates to the sound of the bell, especially when it is presented In other words, especially when the bell is presented again after a period of time has elapsed after the extinction occurred. Here you can see that the conditioned response had undergone an extinction, as represented by the strength of the response dropping to near zero. But then after 24 hours of rest period, during which the sound of the bell was not presented to the dog, you can see a spontaneous recovery. In other words, the dog suddenly salivates to the sound of the bell. Although the strength of this response is not full or not in full strength. Note too that the extinction again occurred as a conditioned stimulus continued to be presented without the food. So this brings us to the third characteristic or property, stimulus generalization. Stimulus generalization is when the dog salivates not only to the sound of the bell, but also to the doorbell. So stimulus generalization is generalizing the conditioned response to similar sounding stimuli. And the last property that we're going to talk about is stimulus discrimination. Stimulus discrimination is an opposite phenomenon. This is our ability to respond, or this is our ability to make slight distinctions between the stimuli, so that the dog here responds or salivates only to a specific kind of bell, the bell that was paid with the food the first time, and not respond to similar sounding bells. So this is our ability to differentiate conditioned responses to different but related stimuli. Now turning to the last outcome for this module, we'll talk about factors affecting classical conditioning. Now let's look at the factors that influence the strength of this conditioned response, the strength of dog salivation to the sound of the bell. Well, the more the number of pairings, in other words, the frequently or the more the conditioned and unconditioned responses are paired, the stronger the conditioned response is. In this example, uh, the more you pair the presentation of the food with the sound of the bell, the stronger the dog learns to salivate to the sound of the bell. Well, there are exceptions to this, and the exceptions are the taste aversions, in which case single pairings are sufficient. The strongest conditioned responses occur when the conditioned stimulus, the sound of the bell, is presented before and during the presentation of the food, the unconditioned stimulus. If it is just presented during the presentation of the food, the conditioned response of salivation is not that strong. For the dog to learn to salivate and the strength of the salivation to be strong, the sound of the bell should be presented before and continued during the presentation of the food to the dog. A stronger unconditioned stimulus typically produces faster conditioning than does a weaker unconditioned stimulus. In other words, the dog learns to salivate to the sound of the bell if the food that you're presenting with that sound of the bell is strong as opposed to bland. So if you present the food that smells, that has flavor, as opposed to presenting that is more dull, then the conditioned response would be stronger when the food is strong. Yeah, I want you to watch this video and learn more about how phobias, both the learning of phobias and the treatment of phobias can be understood in the context or by applying the principles of classical conditioning.
Meet 22-year-old Mariam Doom from Venezuela, clinical psychologist Lars Göran Erst from Sweden, and Alf. He's an American corn snake. This multinational threesome is working together. Mariam helps out when Alf gets tangled in Erst's belt loops, and Erst helps Mariam put Alf around her neck. The picture looks simple enough, unless you go back in time, just 3 hours ago, as Mariam was preparing to meet Alf for the first time. Mariam has a specific phobia, a fear of snakes. Other specific phobias include claustrophobia and a fear of flying and thunder. Mariam's had almost no contact with snakes and doesn't know why she's afraid.
Since I remember myself, I remember being afraid of snakes.
She has trouble with movies.
I have to close my eyes, always.
At the zoo.
It's impossible.
And it interferes with her life.
I have dreams of snakes. It's horrible. Like, I like to scuba dive, and there's like eels and other snakes.
Mariam is a research technician here at Boston University's Center for Anxiety and Related Disorders. Psychologist David Barlow is director of the center and a pioneer in exposure therapy. His research demonstrates the outstanding success that's been achieved in treating phobias in a very brief time period, just 1 week. Some psychologists at the center use virtual reality to gradually introduce a patient to a feared situation. But Erst bypasses all that. He treats specific phobias in just 3 hours.
What he's done, though, over the years, and he leads, in some way, leads the world in this, is strip the program down to its essence.
Barlow invited Erst from Sweden to demonstrate brief exposure therapy.
In the hopes that we will be better able to apply it here in the United States.
And Mariam has agreed to be treated in front of her colleagues. Exposure therapy requires that patients gain experience with the feared objects.
Unless one is willing to experience one's own negative emotions and expose them as not dangerous and overwhelming or threatening, then they probably will not be able to overcome their anxiety and phobia.
But some say this intense exposure is cruel.
I disagree completely, because everything we do in the treatment is decided by the patient, and it is within this time limit, a very gradual approach.
There are surprisingly few people, given the suffering that they have endured up until this point, who aren't willing to take that plunge and see if they can overcome it.
People have this idea that you suddenly pick out the animal and throw it in the lap of the patient. That will never happen.
It's teamwork. Erst interviews Mariam for 45 minutes and then describes and prepares her for treatment in an additional 15 minutes.
So I will challenge you to try things, but I will never force you to do anything that you're not.
It's critical to determine Mariam's worst fear, what's called her catastrophic belief. Her catastrophic belief is that if a snake is loose and she can't escape, she'll have heart failure.
How certain are you then that you might die as a consequence of that interaction?
Maybe 70%.
70%, okay.
No one has ever died or become ill either with Erst's or Barlow's treatment, but Mariam believes her anxiety won't diminish and she'll escape.
Like run away from the room.
The strong belief in the catastrophe, that is what's driving the avoidance behavior. And the avoidance behavior is the directly maintaining factor for the phobia.
But if Mariam doesn't escape, Erst predicts her anxiety
It would then gradually diminish as we go along in the treatment.
and, importantly, there can be cognitive changes.
To help you get new information about that catastrophic belief.
Erst does not prepare patients with relaxation or deep breathing.
I don't think it's necessary at all.
We discovered through systematic research evaluating this component that patients receiving these skills, were trained in these skills, who then used them to cope with their anxiety or fear, actually did not do as well.
Deep breathing masks anxiety, and the patient doesn't learn anxiety isn't dangerous. Here it will be used only if Mariam hyperventilates. Just prior to exposure, she rates her anxiety on a scale of 0 to 100.
70 or 80.
Now, it's time to go get the snake. Mariam's anxiety soars.
I can stand with my back towards you if you want to.
Okay.
And then I
Like
can,
when I close my eyes.
and then I can gradually turn.
No.
Standing here now with my back towards you.
Erst does that for 2 minutes. What is Mariam thinking?
It was horrible. I felt that I was going to leave the room and that it was, stronger than me.
And what was Erst thinking about her reaction?
Maybe not the strongest I've seen, but up there among the 25% strongest.
But he knows that initial anxiety is not the best predictor of success. It's motivation to succeed. She lets him turn around after 3 minutes.
Okay, I'm going to close
Okay.
my eyes. Okay? But don't come.
No? You're doing good. Just try to watch it. It's in my hands.
She looks for the first time.
That's the only way you are going to get new knowledge. It's completely peaceful.
She stands and smiles as her anxiety level comes down.
50.
She's learning.
That if you stay exposed to the situation long enough, you see that the anxiety level goes down.
She lets him enter after 8 minutes. She realizes that her catastrophic belief can't occur unless Erst releases the snake.
I'm not doing that.
After 15 minutes, Erst sits down. Some anxiety returns.
Try to breathe slowly and calmly and with your stomach.
She calms down.
So, what about a name for it? And where are you going?
I'm going to move here.
Okay. What do you think it feels like?
This is a nice snake.
Her anxiety is down.
30, great. You're sitting about, what is this, 3 meters away?
She decides to approach.
Okay, I'm going to approach you. I'm going to approach you.
Yeah, good.
But hold it.
Yeah.
What psychological principles might account for the improvement so far?
It might be that you have habituation going on, which leads to extinction of the anxiety reaction. You could say that the confidence is increasing, self-efficacy, Bandura's ideas come into play here. From a cognitive point of view, I think what is happening here is that the patient is, with the help of a therapist, accepting to take in new information.
There's also positive reinforcement and modeling. What's Erst's assessment so far?
Deep in my mind, I know it's going to work. That means that I don't have to be impatient, I can be calm.
Certainly his research supports his confidence. Across several types of specific phobias, even with children, Erst's research shows over 80% improvement compared with control groups, and the results are maintained at a one-year follow-up.
Well, the research is actually very, very strong. I must say surprisingly strong when you consider the kind of dramatic nature of the intense approach.
It's close to 1 hour now, and she decides to name the snake.
Maybe Alf.
Alf?
Yeah.
Okay. Alf, that's a nice name. What would it feel like touching it?
I'm thinking about it.
Yeah?
After an hour, she touches Alf.
Good. Did you touch it?
A little bit.
A little bit, yes.
I can't believe I'm touching a snake.
You are touching the snake.
Progress is very uneven throughout the afternoon, but it provides an opportunity to challenge the catastrophic belief.
Moved. And you died.
No,
No, you survived. Great.
Alf is placed on Mariam's lap, but again, progress is uneven. Alf's on her lap now, alone.
one more time.
One more time.
And finally, it's time to test Mariam's catastrophic belief. But Alf's more interested in the radiator and warmth.
The snake didn't do a lot of things that she predicted it would do.
What about Mariam's catastrophic belief?
Is it down to 0?
Yes.
Good.
Now it's time to pose,
A
Can you,
picture.
can you stand?
and then help untangle Alf. As for her anxiety,
Yeah, and at the end, when I was helping her, it was 0 completely. That impressed me, the last part really, that I was able to do that.
there was time for some celebration and congratulations,
Did you really think you'd be able to get this far?
and reflect on the implications for treatment.
We have no reason to believe that the 3-hour program would be any less effective than the 1-week program. So then it becomes an issue of, what would the patient choose? There are many patients who really don't have the time to take a week out of their lives.
The recommendation is that Mariam engage in maintenance, watch nature films, go to the park and the zoo.
Is that if I see a snake on the street, at least I'm gonna be able to see it and walk, and not see it and run.
And 2 months after treatment, we spoke with Mariam by phone.
I have dreamed with snakes, but I didn't have any anxiety. I also watch movies with no problem and pictures, so I think that I'm doing great. I really feel confident that if I see a snake, I won't be scared.
Also, I want you to think about and try to apply how the principles of classical conditioning can be applied to real life situations like these. In this video, we discussed some important constructs specific to classical conditioning. In the next video, we'll talk about the second form of learning, namely operant conditioning. Well, this brings us to the end of the first module, where we talked about classical conditioning, looked at the main principles, and also talked about the factors that influence classical conditioning. In the next video, we'll talk about operant conditioning. Whereas classical conditioning is learning via association, operant conditioning is learning through consequences. And we'll talk more about operant conditioning in the next video. Thank you very much. Whereas classical conditioning is learning through association, operant conditioning, on the other hand, is learning through consequence. So consequences, and in the next video we'll talk about operant conditioning.